Hello, egunon.
Good morning. Good morning, everyone. Egunon, as we say in the Basque language. Well, first of all, I would like to thank the organisers on behalf of my group for having invited me here to talk about this experience that we are carrying out at our local council and in the area of Duranguesado here in the Basque Country. We are aiming to set up local health networks. It's called There Is No Life Without Care. And it's aimed at migrant women who are looking after dependent people. Because what we saw was that our small society, our small care society, didn't really put the life of people and their care at the center of things. And then we saw that there was an opportunity to improve the health of people and their situation. And we thought it was an important opportunity that we couldn't let pass by. Now, care is often carried out in a domestic sphere, in the home, by people who don't receive any pay for this. Socially, this task generally falls to women, but this is changing. There are some changes in society which is destabilizing the former family model. Some authors talk about the crisis of care as well. Now, as the health service, we actually become responsible for covering this particular health need. And we were asking ourselves, well, who looks after this and how are we looked after? And in 2017, the Association of Female Domestic Workers of Vizcaya, the province of Vizcaya, found that 97.97% of women working in the domestic sphere were actually lived with the people that they looked after. And 71.6% of them did that in illegal situations, and with regard to their timetable and their rest days. For example, even Lanbide, which is the Basque Employment Centre, presents some statistics that say that more than half of these women are of foreign origin and they have migrated from countries outside the European Union. Looking at this, we saw very clearly that care and care work is something that cannot be provided in conditions of insecurity for both the carer and the patients themselves. And so something needed to be done. In our primary care system, we decided to set up a network that would enable us to tackle this problem through training, to provide an integrated interdisciplinary perspective which would include all the different outlooks, everything related to care. Our starting point was that we were going to mainly be working with migrant women, mainly from Latin America, living in situations of extreme loneliness, social isolation. And in September of 2017, we began, in collaboration with the Basque National Health Service programs as well. In collaboration with them, we started to structure our intervention. Now, the strategic programs set in motion by OSAKIDETZA, the Basque Health Service, clearly say that all programs need to be well coordinated between the different stakeholders, and we were very aware of this. Now, we had doubts about our methodology at the beginning, so we had to find the right methodology, but back in September 2016, we did find that OSAKIDETZA suggested a good methodology for us, and in fact it was going to be that methodology that was going to guide our intervention. It consists of an analysis, the design, then the implementation of a program which would be adapted to our local environment. What were the aims? First of all, it was to increase the technical knowledge and abilities of the migrant women who were carers, but we also wanted them to acquire this knowledge in the field also of looking after themselves, as well as looking after the dependent people with whom they work, so both themselves and their charge. This led us to some secondary aims, which was to establish a community network with a favourable institutional support. in order to be able to set up a true community network and to increase security and safety at work for the carers, to improve the quality of the care received by fragile or dependent older people, to help with self-care of the carers themselves, to foster their integration, and to help with their empowerment. With all of these aims and goals, we thought, okay, well, that's well and good, but how are we going to do them? How are we going to achieve them? So there are a number of different phases that we can distinguish here in this process. First of all, we had a steering committee, which was an interdisciplinary group. We had representatives from primary care, the Basque Health Service, the social service of the Durango area or region, where the social workers work. The Department of Equality at the local council also sent a representative, and we worked together to establish different areas or strategic areas to identify what stakeholders were going to be involved and to try to move the project forward. We drafted different documents and proposals, etc. We prioritized the working group, and we were interested in involving the target population as well. We wanted to see what they were concerned about. We carried out individual and group interviews to do this. The secondary aim was also to stimulate the participation of these people as well. We wanted them to collaborate with us as well. We identified what sort of social assets we had, different associations and organizations working in the area, and the different physical resources, the economic resources and the cultural resources as well. We explored the potential of these different community participants. We identified leaders who were well considered in the community, who could actually serve as ambassadors for the process. And we carried out data analyses to try to determine what sort of indicators that we had for mortality and comorbidity. We carried out the community review with a working group, and all of that led to the design of the program, taking into account all the different perspectives so that we set ourselves with a mission and a vision, etc. And this was then all specified in the training program for female immigrants working in the care field, looking after dependent elderly people. Now, I'd like to focus on this particular part in particular because I wanted to explain to you something which I believe is a defining element of the way we work, and that is that we strive to set up a community of practice involving different social stakeholders, social assets. We want everyone to participate in these workshops in order to understand what our target population really wants, what their perspectives is, what their opinions are, and to focus the design on this so that we can adopt a global network-based perspective right from the very beginning, putting people at the center of the entire program. By people, we mean the people who are dependent and the carers themselves. We developed a training program in which 20 women worked with 10 theoretical sessions and other inputs as well. We talked about healthy habits, general care, general health care, and also care for people, elderly people. And then we also had, these were 6 classes, and then there were 4 classes which were interspersed between these other 6 classes, in which we provided what we call participatory popular education. Now, this was led by a feminist sociologist who was also an immigrant herself, and she focused on the social integration side of things, which was something that we needed to include in the training, as well as all the different theoretical aspects. So we held different group dynamics to present the methodology, to establish the commitments. This was done in the first session. And there, it was not just the teachers, it was also the steering committee was there as well, and the women themselves. We alternated empowerment sessions, self-care sessions with all of this as well, how to find allies, how to create a support network so that the women themselves could establish their own support network. There were final sessions afterwards in which the teachers and the promoting group came back together to assess the results in order to get a qualitative idea of the degree of impact that our intervention was having. Now, with regard to results, we had good attendance levels, and with regard to the knowledge acquired, we did pre and post tests, and the average score was high. What we learned mainly, we learned from the qualitative evaluation of the program carried out by the promoting group and the target group as well. And all of this was thanks to the workshops that we held. With regard to adherence levels for the local health network was a satisfactory level. A lot of organizational meetings were held and attendance was very high. With regard to the dissemination of the initiative, we can say that the results were fairly positive as well. Because in fact, the women, the carers, ended up giving talks themselves, talks about cooperation, and they were telling about the necessary and invisible work that they do and how this invisible work should be visible and should be seen by everyone. With regard to satisfaction levels, we can see an empowerment as well. We can see that empowerment increased and their level of relationships with other people. We saw that, in fact, behaviors changed. There was a greater degree of participation in the different events that were organized. Collaboration with the local cultural center as well. Outings to the theater were organized. Dinners were organized with the participants in the network. So the whole experience was very satisfactory. There was a good level of dissemination, because you should remember that we're talking about a first initial experience, which is like a pilot experience, in which our goals were achieved, were met. Very, very good level there. The general knowledge in the health and social fields of all participants, not just the carers themselves, but everybody involved, has increased. And we've seen that the self-care of these women as well, and the promotion of their own health has improved as well. They've participated in programs to promote healthy living, vaccination programs as well. Now, no matter what the relationship with regard to the coordination of the network, it's very useful to make sure that these relationships happen at the same time, that we should work on forging personal relationships as well. What are our conclusions then? Well, the idea is to scale up this initiative so that it can have a greater impact on this particular field. When we were thinking about what we had achieved, we came to the conclusion that it was a viable intervention with positive outcomes with regard to people's satisfaction and experience. Working as a community network always has to have a good methodology to guide it. And also it was important to avoid overlaps, duplicities, in order to reduce administrative costs. And we were able to do that at many different levels. Because in fact we have fewer hospital admissions, fewer home visits, because the care that these people are receiving is improved right from the very start. There is a greater degree of integration of these women. They become more integrated in the society in which they live. And we also decreased the exclusion level of the target population, which was migrant women. There are still some barriers, and we are analyzing them at the moment. It's important to work as a network, and in order to, we have to make sure we get the right system to get a good deployment and scaling up of the initiative. Just to finish, I would like to tell you that we're still very enthusiastic. We're working very hard still to increase our impact in order to provide greater value to patients and to society in general. After the training session that we've carried out, we are now organizing a cycle of 3 workshops with the same participants, so follow-up workshops. And we've also started providing the initial training with a new group of women. And because we see that they are activities that really are beneficial to all involved. Because we're also trying to interrelate the different activities with the first group of women, with the second group of women, so that some of the members of the first group can become facilitators for the second group. All so that we can reach our final goal. Thank you very much indeed.
Muchas gracias, Maribel, por esta excelente.
Thank you very much, Maribel, for telling us about this excellent initiative. Does anyone have any questions?